Bond is a novel synthetic bone graft material considered to be a breakthrough in the field of dental bone grafting. It is composed of biphasic calcium sulfate, which has well-established and documented biocompatible osteoconductive and bioresorbable properties. The biphasic is fast-setting and stable. Its physical properties are not affected by the presence of blood or saliva. Bond is available in a granulated powder form, which is packaged in 1 cc and 0.5 cc drivers and arrives in a 3-unit package. This is Bond. It has 4 components: cap, head, tube, piston, and the granulated powder. Only 2 minutes are required to prepare and implant Bond. Before applying Bond, make sure you have the items described: a sterile Bond driver, sterile saline, dry gauze pads, a sterile medical syringe and a sterile medical needle of at least 1.25 inches or 31 millimeters, granules, a spatula, and a sterile dish. Step 1. Pull the driver's head entirely and add Bond to the overall granules within the dish. Use a volume ratio of 2 parts Bond to 1 part granules. For example, add 1 cc Bond to 0.5 cc granules. Step 2. Use a spatula and mix the dry blend thoroughly. Step 3. Add saline for complete wettings of the blend. This is important in order to achieve a complete moistening of the blend. Use a spatula to mix the blend thoroughly until obtaining a homogeneous creamy texture. The texture is ready when it's well mixed and has a shiny and glossy appearance. Step 4. Absorb water surpluses by applying a dry gauze pad above the mixture. Do not use pressure. The texture is ready when it's well mixed and has a matte appearance. Step 5. Use the empty Bond driver as a carrier for the putty by drawing the piston to line 1 marked on the driver and reload it with the putty. Use the same maneuvers such as loading amalgam to collect the putty. Step 6. Apply the Bond composite graft into the required site by pushing the piston and ejecting the composite graft. The bone defect has to be entirely filled with composite graft in order to obtain a good contact with natural bone. Step 7. Shape is necessary to achieve the desired form. Apply a dry gauze pad for 3 to 5 seconds and condense the composite graft. Make sure the time elapsed since the material encountered saline did not exceed 2 to 3 minutes. Step 8. Wet the gauze pad with sterile saline and place it on the graft. Remove the gauze pad after about 30 seconds. Proceed with soft tissue coverage and wound closure. Before applying Bond, make sure you have the items described: a sterile Bond driver, sterile saline, dry gauze pads, a sterile medical syringe and a sterile medical needle of at least 1.25 inches or 31 millimeters, and a sterile dish. Step 1. Push the piston to line 1 marked on the driver. Twist and pull to remove the driver's cap. Step 2. Insert the syringe's needle through the driver's head. The needle should be long enough in order to reach the piston. Eject the saline from the syringe into the Bond driver. Eject until saline drips out. Do not block the driver's aperture. Make sure the material is entirely wet. Step 3. Hold the driver's head handles firmly and push the piston to the direction of line 2 to expel liquid. The pressure should be applied until a resistance is felt caused by the putty. Step 4. Hold the driver horizontally and remove the driver's head by twisting and pulling. Step 5. Cover the aperture using a dry gauze pad and slightly push the piston against it. This will absorb liquid surplus to obtain the desired viscosity. Step 6. Apply the bonbone putty into the required site by pushing the piston and ejecting the putty. The bone defect has to be entirely filled with putty in order to obtain a good contact with natural bone. Step 7. Apply a dry gauze pad for 3 to 5 seconds and condense the putty. Shape is necessary to achieve the desired form. Make sure the time elapsed since the material encountered saline did not exceed 2 to 3 minutes. Step 8. Wet the gauze pad with sterile saline and place it on the graft. Remove the gauze pad after about 30 seconds. Proceed with soft tissue coverage and wound closure.